This is kind of how we learn. I chose this field because I live with an amputation myself. I'm missing my leg above the knee, and I've been using a prosthesis since I was 12. And it's been a long journey, and I feel like this field is very personal to me.
Claudine Humure is a graduate student in the University of Washington School of Medicine's Prosthetics and Orthotics program.
As a student at UW, like we see patients of all ranges. So our classrooms try to mimic what we will see on the field once we graduate. I think it's the best way to learn, honestly. I learn best by doing, and I think it's great.
Claudine is from Rwanda. When she was an infant, both her parents died in the 1994 genocide. She was raised in an orphanage, but then lost part of her leg due to cancer when she was a young girl. Honestly,
I feel like no one gets through life by themselves. We all need help along the way. At least I'm a testament of that. I don't think I would have gotten here without the help of others. I want to open a prosthetics clinic in Rwanda in the future. And I know that like Rwanda had a genocide in 1994, and a lot of people who are missing their limbs are victims of the genocide. But you also have like people like me who lost their limbs through like different diseases like cancer, diabetes, like, and other infections. Yeah. You're strong. I know like how it feels when you first put on your first prosthesis and you are able to do things you didn't know you would be able to do before. It's a rewarding feeling. It's a beautiful feeling as a patient, but it's also a rewarding feeling as a clinician providing the care to the patients.